All right, we are live.
Yes, yes.
Hi, guys. I'm back with Dr. Alex again. And today we're talking about a very sensitive topic, um, but it's something that affects a lot of people. We're talking about the thyroid.
Mm, yeah.
Yeah, this is a very good one because there are so many people that are dealing with thyroid issues, and oftentimes these things can be misdiagnosed sometimes as other things. So, we just really want to give you general information about what your thyroid is, kind of what it does, and just, you know, answer any questions that you may have that we can possibly answer for you. So,
Yeah.
Dr. Alex, do you want
Hello,
to tell us a little
Sarah.
bit
Thank
about
you.
the topic?
Thank you for having me back. Hi, everybody. I hope you are enjoying these sessions with Sierra and I. Yeah, like Sierra mentioned, it's really important that we get a sense of what the body is trying to tell us. Because after all, when we understand that the body symptoms are really just a sign of miscommunication within the body, then we have to kind of look back at what point did the body stress level overburden the ability for the body to properly communicate.
Mm-hmm.
So a thyroid is just a really important little organ, I guess we can call it that. However, the one thing that we all need as a building block for a thyroid to properly function is actually your protein, tyrosine, as well as iodine.
Mm-hmm.
So people who don't really have iodine in their salt or don't take iodine at all actually could potentially have a reason that something goes awry with the thyroid because of that simple fact alone.
Mm-hmm.
We also know that most hypothyroidism, which is inability of thyroid to function the way it should, as opposed to hyper, which is increased function of the thyroid gland, it actually is tied very, very closely to a traumatic event that happened anywhere between 6 to 9 months prior to thyroid symptoms going awry. Okay. So we really need to look at lifestyle options and lifestyle choices that are part of our everyday life that could be contributing to how well our thyroid is functioning or perhaps not. You
Right.
add anything to that, Sierra?
Yeah, so your thyroid is very important because it does so many things within the body. So Dr. Alex told us what hypo and hyperthyroidism is, but I want to make this very clear that this is a very common issue. 1 in 8 people are dealing with an underactive thyroid right now, and a lot of times people don't even know that they're having these issues. They see the symptoms and they don't know exactly what's happening, and they may not even seek help for it because these are normal symptoms. So
Right.
someone may feel like they're overly fatigued, or they may lose or gain weight. You could start noticing that your hair is thinning. You could start feeling just very groggy and having brain fog, not being able to remember a lot of things. And this can all actually be symptoms of your thyroid, and you might not even know that you have a problem. And it's not only important for everybody, which it's great for everybody. Everybody needs a functioning thyroid, but especially when we're talking about the female body, your ovaries need your thyroid to function properly. If you are carrying a baby, they need your thyroid functioning properly because it is what supports their growth while they're inside of you. So the thyroid is very, very important, and you want to pay attention to what your body is doing because it's giving you signs that there is a problem. Even simple things like constipation could indicate that you're dealing with this
Absolutely.
issue, especially if it is tied in with some of the other things that we've already talked about.
You'll notice me, guys, looking down. So that's because I am literally having my neurology book, my notes from school that I pulled out, and I just want to kind of add a few things that Sierra is talking about, right? Because this is a very complex topic, and our intent here is not to share any medical advice with you, because that we don't practice that over Facebook, right?
Mm-hmm.
However, we just want to talk in generality of what you could potentially be experiencing or are currently dealing with in your life that could warrant a visit to a medical doctor or perhaps somebody else,
Mm-hmm.
to kind of see what is your body really telling you. How well is your body communicating with itself? And again, as you guys watch Sierra and myself interact in these, we really are a huge advocate for building health prior to, growing a family, prior to a lot of expansion in your family. Because again, when we are healthy, the baby that we're growing is going to be the healthiest. And like we've said multiple times in the interactions that her and I had, and I'm sure if you're watching us for the multiple times, you know that health is a journey.
Mm-hmm.
It's something that we kind of start and we build on. We come to a certain point and then we look for what else can we improve or add on so the quality of our life is that much better. But absolutely, I mean, like she said, uh, thinning hair or gaining weight, all of those are potential reasons to consult a doctor and see what is going on.
Mm-hmm.
Um, outside of um, perhaps medical doctor, there are doctors who do functional medicine that will also be a good fit for you to look at. Where do you kind of stand, right? Functionally, look at your numbers, your blood counts, and all of that to make sure and understand what is the body really telling us. Where is it heading? Is it heading towards hyper, increased activity or something, or hypo, decreased activity of something? Um, and again, it's just nice to know, because the more you know, the more proactive you are in your choice to decide where you head with this, right? And from a chiropractic perspective, we always talk about the body is best able to handle anything that it has to deal with a fully functioning nervous system. Because because we know from the hypothalamic axis, we know that your thyroid is governed by the things here in your brain, and then signals come down into your thyroid, and then the T3 and T4 are being produced, and all of that, right? Thyroid stimulating hormone that sits up here in the brain. It starts here, but the way the brain knows how to do that is by receiving messages from here. And this is what we call a positive loop, right? It talks to the thyroid, talks to the brain talks to the thyroid, but the only way it talks to it is through your nervous system. So the way we would make sure that the communication between the bodies properly happening is through your nervous system, making sure, again, communication, because one major problem in anything in the world, right, is the communication, right? You
Mm-hmm.
never want to assume anything and perhaps say something that you just assumed was the right answer or the response to the question being asked. You always want to clarify. And that's really what the nervous system does for the body. It's making sure that whatever the internal body is telling the brain, we know that that's reality of the current situation. So again, to me, I think that should be the basis of any kind of recovery or building health upon, is making sure that your nervous system is at its integrity, so that any communication happening between a organ or a gland to the brain is at its optimal so that the body can self-heal, self-organize, or self-communicate just like it's designed to do. Right?
Mhm.
Does that make sense?
Yes, that makes great sense.
So,
So, when
yeah.
we're talking about the thyroid, though, we know that you said it can be where you have too little iodine. And Dr. Alex just gave us, a plug. If you're not eating iodine-rich foods, if you're not getting it through your salt, because I know that a lot of people, including myself, when you come into this health journey, one of the
Uh-huh.
things you want to do is get rid of the iodinized salt. You want to
Yes,
start eating sea salt and all of these things. But if you don't eat a lot of iodine within your diet and then you take out the salt, that can cause issues. So you have to be very careful with what you're doing to your body and pay attention to how it's responding to things so that you know when to go and seek help. Now, if you
absolutely.
do seek help, what things do we need to look out for? So if we go to the doctor and we say, okay, I've been feeling really sluggish, my hair is thinning, I'm gaining weight maybe, then we want to ask them to do certain types of testing to make sure that we are okay. So some of those things are like the full panel thyroid testing.
Mhm.
And
Correct.
if you don't have the full panel thyroid testing done and you notice that you're having some of these symptoms, like, maybe you do have thinning hair and you're gaining weight, that's not a reason for you to start self-medicating.
Absolutely.
Do not do that. Please go and make sure that you have those panels done so that you know, just like Dr. Alex said, exactly what's happening in your body. Never ever start doing something to yourself without knowing what's happening on the inside.
Absolutely. Yes. Yes. Always consult a professional, a medical advice when you decide to change something with the body. But what we're here really trying to teach you or encourage you to is to listen to the body, to be aware what is a normal body, what is perhaps a body that's struggling and it's giving you symptoms or small warnings or a smoke alarm detection, right? That's telling us, yeah, perhaps we need to take a look at this. And before, these larger symptoms arise, like in hypothyroidism, right? Major symptom actually is a depression.
Mm-hmm.
Guess that. I mean, who doesn't every once in a while have a gloomy day, right? That
Yeah.
doesn't mean that you already have a thyroid problem. That just means if for extended period of times you guys have depression, perhaps maybe it's the thyroid we should look at.
Mm-hmm.
Um, what is this? Muscle aches, fatigue, gain of weight, right? Constipation,
Mm-hmm.
lapse in memory and concentration, husky voice, for example, that can also be an issue. Um, bradycardia is when the heart kind of slows down in the beat. So
Mm-hmm.
that, but then again, bradycardia has a lot to do with your electrolytes. Are you having a lot of sodium and phosphate? I believe it's K, right? So a lot of that has to do with overall mechanism of the way the body is designed and it's functioning, right? You can't really just look at the thyroid and expect it to be the only problem or the only solution to your problem, because we know thyroid, as a matter of fact, is influenced by your blood glucose level, your insulin. So if you have problems or are on the low or high scale of insulin normalcy curve, then we know that that could also be contributing to perhaps your thyroid problems. So there
Mm-hmm.
is a slew of things that we can kind of, again, go back and forth as to what is the chicken or the egg kind of question, right? Sometimes in these complicated cases, we hardly can tell what the actual precipitating event could have been. But we always know that it is coming back to the amount of stress the body is unable to respond to. And we divide that stress into three things. chemical, emotional, and physical. So we always have to look at that. When in our life the balance scale was tipped over to something and the body is now compensating.
Mm-hmm.
And guys, in a case where the balance scale is tipped off, for you and for me, it was acne. For you, it might be thyroid problem, but for somebody else, it might be a totally different um, symptomology or
Mm-hmm.
expression of that imbalance. So really, every disease is really just an imbalance, but in different people, it is expressed differently because we know neurodegenerative diseases, they really have the same mechanism of why they happen. It's just a matter of the expression from person to person that deviates. So if the mechanism is the same, don't you think the resolution it should be the same? But yet we have so many different things being offered to different neurodegenerative diseases. So think about that a little bit.
Yeah, and I'm glad that you brought up insulin resistance because we're also talking about hormonal imbalance today. And one of the big things with hormonal imbalance is insulin resistance. If you look at almost, I don't want to say any disease, but a lot of the ones that I've researched, hypertension, diabetes, all the big diseases that everyone is talking about right now, all of them have something to do with insulin resistance, PCOS. We've even seen research about how miscarriages can come from insulin resistance. So you really have to look at what you're putting into your body and whether or not your body is able to absorb those nutrients properly and how it is able to handle the stresses that you're dealing with every day. But if you're dealing with some type of insulin resistance, especially if you are a diabetic or you are borderline diabetic, because oftentimes what they call borderline is already at a very, very high risk. And you should probably start taking the steps to change your lifestyle in order to help kind of try to manage that a little bit and work alongside your doctor to make sure that things are going well. But you have to have your insulin levels working and functioning properly in order for your body to function in general across the board. If insulin is off and it's not working, if you don't have enough or you have too much, your body can start doing a lot of really wonky things.
Absolutely. Yeah. I mean, when you start looking at the body and the way everything is really interconnected,
Mm-hmm.
it really does not really work to our best advantage to have what we call these specialties in medicine, right? A cardiologist. And so that then we as the providers tend to sometimes lose the connection with the rest of you, and we just kind of like, oh well, the heart now is under control, okay, we're not even going to look into it any further, right? So
Mm-hmm.
it's really, a body is an ecosystem. It is a unit composed of multiple small pieces. It's like a puzzle.
Mm-hmm.
It's every piece has its place, and every piece fits into a certain position. So if you don't place it where it needs to go and it's not completely filled, then first of all, you don't see the beautiful picture that the puzzle is designed to display in front of you, right? And then if you are really not able to put them into pieces, you get frustrated. And it's the same thing with the body. When the body is not able to properly communicate with the right parts of the body that it needs to, then it just gets frustrated. And that frustration are your symptoms, really. So, really, the beauty that we are designed with is just so profound, and it reserves so much respect from us, and it's a really easy way to honor it by listening to it and not really working against it but with it.
Yes, absolutely. And pay close attention to what's happening. And I want to say this because I know that myself as a mom, you hear people tell you things that, like, oh, it's okay for you to be tired all the time. Moms are supposed to be tired. But if you notice that you're tired every day, no matter what you do, if you go to bed at 8 p.m. and you sleep until 8 a.m. and you're still just tired, first of all, that's probably too much sleep. But if you did that and you just wake up and you feel really, really tired every day, and you notice that your body temperature is low. So for me, I used to be that person. If you're checking your temperature, and I was doing it when I was trying to conceive, but my temperature levels were never at what they were supposed to be. It was always 96, maybe 97. And for me, that had a lot to do with being anemic because I was. But for another person, that could be telling you if you're tired and you're having low body temperature, meaning you're cold all the time, or you notice that your temperature is never really right, that could be telling you that you have a problem with your thyroid. So you wouldn't know that if you weren't paying attention, or if you thought it's okay for me to walk into the kitchen and not remember why I came here in the first place. It's okay for me to be constipated every other week. People tell you these things all the time, but you have to know that your body's saying, hey, listen to me. Something's off. Something's not right. So pay attention to what's happening so that you can then go and take these symptoms to your medical doctor and say, listen, I've been checking my temperatures for the past month. My hair has started thinning. I've been gaining weight. This is happening, so that when they go to look for something, they know what to look for. You shouldn't walk around feeling you're tired and not being able to remember everything or anything just because you're a mom. That's not normal.
Absolutely. I also think that sometimes people don't even realize how burdened their systems are, because you'll ask somebody, how's your constipation, and they're like, oh yeah, it's fine. And then you're like, so how often do you eliminate? Every other day, every third day. And you're like, that's not normal, even though unfortunately you will hear that from some providers saying it is. That's your cycle and that's normal. However, that's not normal. You should have a bowel movement at least once a day, if not after every meal, guys. That's how important that process is. And again, it has to be so in tune with each other. But that not only has to do with your nervous system, that has a lot to do with your gut health. That has a lot to do with your activity. That has a lot to do with the hydration that you're using. And then absorption, and absorption has to do with gut health. That has to do with vagus nerve integrity. That is like a slew of things, yet our solution predominantly is, but help it with Mucinex. I mean, what is that really going to do if we just, it might help some, but what is it really going to do if we just counted 5 or 6 possible interruptions in the system that are contributing to somebody's constipation, right? Same with thyroid, right? The body has to be, like I said, in constant communication with itself. Any small deviation from 100% of communication, we know that the body is not at its optimal. And one way or another, the body is going to blow a fuse. And that fuse, like I say, for some, it's going to be a thyroid problem. For others, it's going to be this. But it's always just telling us that the body is not able to comprehend itself. And I think when we kind of look at the ability of us to progress within work, for example, right? The manager is always going to ask you, what are your strengths? How do we make sure that those little things that might be coming in our way, like your weaknesses, how do we make sure that they're so negligible, right? So they never come to the surface and they never overcome your strengths. So that's the same thing. We're just trying to find out, where is the body's strength? How do we make sure the body displays strength most efficiently? And again, that comes into a sphere of healthy habits. Proper movement, proper hydration, proper nutrition, proper nerve supply, right? All of that is part of a healthy body. And then the body expresses health. The body is able to regulate, self-regulate the thyroid. That communication between the brain and the thyroid is good. The communication between your adrenal gland and your brain is really good. And it's not active all the time because you're not being chased by the bear, even though that's your
Mhm.
perception, right? So again, the body is really an neuroimmunomodulated system. It's neurology, immunology, and endocrine system. Your immune system, your nervous system, and your hormones, right? Insulin, thyroid, all of those are hormones. But the way they're expressed starts here, starts with your brain. And the brain receives information from five senses that are external and that are internal. We have
Mhm.
four of them that are internal, including your vagus nerve, right? Your proprioceptions, which is your joints in space, right?
Mhm.
So if those are not where they need to be, if that process is not the way it's supposed to be, then as 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 if any IT people are listening right now, you guys know garbage in, garbage out, right? Same thing goes with the brain. If the brain receives information that it cannot use, the brain is going to fill in the response. Now, that filled in response may not be appropriate for you or the situation you're in right now, but the body just moves, keeps on moving. And hence, that's how things deteriorate.
Yeah,
And we call
absolutely.
it, and we may call it hypothyroidism, we call it diabetes, we call it X, Y, and Z, doesn't really matter. It's just dysfunction. It's just
Mhm.
her body not able to communicate with itself and its environment. So if we start looking at it that way, I think we realize what a beautiful, beautiful system and design we really are.
Mhm. Absolutely. And we have to keep things functioning properly so that our bodies can continue to handle the stress that we're going to be under anyway, just because of our environment.
Absolutely.
And so that we can continue to age without all of these other issues that are now
Absolutely.
becoming more and more prevalent in our older population as well.
Absolutely. But the thyroid, for example, to get back to it, I have 13 functions that
Mhm.
are related to it. So it starts with carbohydrate metabolism. Okay, what do sugars? How does it regulate sugar? Okay, so how does it signal perhaps some things for your glucose to be monitored? It's responsible for fat metabolism, right? Where do we store fat? It's responsible for increasing the breakdown of your protein.
Mhm.
Mm, what else? It's responsible for that sodium, potassium, ATPase pump, right? Your energy is actually dependent on your thyroid.
Mhm.
Your vitamins, your bones, and your growth actually is impacted by your thyroid.
Yeah.
Um, your cardiovascular stuff is impacted by your thyroid. So it's a slew of things. But then again, think of it this way: if the thyroid impacts this, all of these systems have to have a way to talk to the thyroid, whether thyroid has to be involved to regulate any of these systems. Again, and the only way it regulates or communicates through is your neuroimmunoendocrine system through molecules, and those molecules are released by your endocrine system, immune system, and your nervous system.
Mhm.
So the only way we can really create a baseline of building good health is making sure that those little molecules are released at the time they need to be released. And that's really what a chiropractic adjustment does for you. It neuromodulates your neuroimmune and endocrine system so that everything else can function beautifully as designed.
Right. So, with the thyroid being connected to all of these things and more, even how you digest your food and the way that you eliminate can be tied to your
Absolutely.
thyroid as well. But if it's in control of all of these different things, it would seem like it's a very, very important gland to have. And yet, oftentimes, when someone is having a thyroid issue, it can be the first thing to be removed. So I don't know if that's necessarily a good thing or not, but I know that we need to pay attention to what's happening so that we know when something is out of whack and something is not in balance, so that we can do our best to make sure that we are able to get things back functioning properly.
Yeah. So, speaking of females, right?
Mm-hmm.
It will actually create a reduction in your periods. If you have excess of thyroid function, it
Mm-hmm.
will increase deficiency in your periods. So again, just because you have a deficiency in the period, the provider may go into the reproductive system, but they may not even look at the thyroid or
Mm-hmm.
what's the brain doing up here to stimulate the thyroid and the ovaries and whatever else not. So again, I actually admire medical doctors for diagnosing stuff because it
Mm-hmm.
is a challenge. It
Yeah.
is a huge challenge to diagnose something because literally you have to be a stellar detective and an investigator to find out what's really going on. Because
Mm-hmm.
we know textbook things happen this way, but not a single person will be a textbook, guys. That's
Mm-mm.
why we have so much training in any kind of healthcare profession. We go through slew of training, we go through case studies, we go through this, but not a single person with thyroid problem will be the same, nor will the thyroid really be a classical book prescription as we learned it in school. Absolutely never. So it really is a puzzle that we always have to try. Um, and that's one of the things that I really have come to terms with, because then you have to have the give the body the opportunity to show you if something is working or not. And
Mm-hmm.
that period of time, because of our inability to really, or our desire to have something instantaneously, doesn't always really fit into that mindset. But generally that time frame is quite longer than we would like it to be, right? That's just the body's way of working. Because
Mm-hmm.
let's get back to the beginning, right? It actually may take anywhere between 6 to 9 months for the body to start displaying symptoms. But the insult of what started that almost happened a year ago, right? So
Mm-hmm.
it will take almost as much to really reset the scale and tip it into healing and health. So we just have to be mindful of that when we are looking for solutions. Um, and that's really what we have. And once we get to terms with that, I think it's much easier to overcome some of these challenges that the body is perhaps saying, give it some time, slow down, you're doing a little too much,
Mm-hmm.
or you right. So we just have to be tolerant to ourselves.
Yes. Yes, we do. We have to be a lot more kind to our bodies. Because if you're running and running and not taking care of yourself and not exercising or drinking water and doing all the things that your body needs, and you don't sleep well, maybe you have insomnia or something, and all of a sudden, as you said, you stop having periods, the first thing that you're going to do is say, oh my God, there's a problem. I know I'm not pregnant, so let me go to the doctor. And then this doctor has to try to piece all of this together to figure out what the problem is. Well, the doctor may not know that last year you lost your grandmother, and then you had 3 other deaths in your family, and then maybe you lost your job all at the same time, and this can cause a chain reaction within your body, and you may have had surgery in the midst of all of it. So there's so many things that could be happening within your body, and it can cause these imbalances. But if you pay attention to it, you will be able to get the help that you need.
Absolutely. Yes. That's why we take case histories in our offices, right, guys? We
Mhm.
want to hear what has happened, what could potentially led up to this point. So that case history is not just for us to take notes or to write stuff down, but that is actually the elements we use to build a case for what could be happening.
Mhm.
And sometimes those pieces may fit into multiple groups. So you just try one based on your experience, your clinical reasoning, your intuition. Where do you start first? But it may not be the right first step. So you then go back to something else. So that's really how the body works. That's
Mhm.
really how it works. It's a trial and error, really, because that's really what allows you to grow, what allows you to experience life, right? Because if we were just all of a sudden magically dealt with some, given everything, then where is the joy in really trying to achieve something? And that's the journey of health.
Mhm.
It's a joy to accomplish something and then to look forward to something more that you can have because you know that the past actions have given you so much you want to supersede that one point in time.
Yes, absolutely. So I think we covered the thyroid pretty well without giving anybody any type of medical advice. But I do want to say that we'll probably come back and talk more about hormonal imbalance because there's so much that goes into that as well. And I don't want to just kind of talk about it a little bit and not really give it as much attention. So we can come back and do that if Dr. Alex will talk to us again. But we
If
do
you'll
thank
have
you
me,
for joining us.
if you'll have me, I'm always available, as you know.
Always, always. So thank you. If you have any questions or anything that you'd like us to talk about, please feel free to message us and let us know. Have a great rest of your day, guys.
Bye,
Bye
guys. Have a wonderful rest of your Monday and the week ahead. Bye.
bye.